You have to look after.
Yes, it goes to my groin when I'm from my tummy. Yes, I do have a bit of pain in my tummy, and then from there it goes down to my groin. I see it just moving
Okay. Did
down.
okay.
Yes.
The pain start suddenly or gradually?
It's there, constant.
Okay. Any specific time during the day that the pain increase?
No,
The pain come and go.
not really. It's always there.
Please describe the pain for me. Colicky, cramping, or stabbing.
It's cramping pain. It's what is colicky and cramping and stabbing?
How badly is that affecting your day-to-day life?
It is affecting me a lot, doctor. That's why I've come to you. I cannot withstand the pain sometimes.
Okay. Have you been unwell recently or had any fever or chills?
No,
Have you any trauma to your tummy or groin recently?
no,
Have you noted bleeding from any other orifice?
no.
How often do you get up at the night to pass urine?
Good.
I have to sometimes get up. I do get up sometimes. In a week, two
Do
or
you have
three
difficult?
nights up.
Okay. Do you have difficult getting the stream started?
I have to press. I have to strain a little, but it's okay.
Is your stream powerful or weak?
It's weak.
Do you have any other medical condition? Any surgery?
Medical condition. I don't know, doctor, but I take one medication for my hypertension. I've been taking it for quite some time, and my blood pressure is under control with that.
Okay.
And I have never been operated.
Okay. Do you take any medication for hypertension or any other disease?
Yes, I take for my hypertension, but I can't recall the name now.
What is the dose use it in to control hypertension?
I'm sorry, doctor, I cannot recall it right now.
Okay. What's your occupational?
I work in a factory.
Who is the home with you?
My wife.
Do you have any difficulty with the stair?
Sorry?
Difficult in
Do you have any difficulty with the stairs?
At my age, it is very natural, but yes, just walking uphill. Sometimes I feel up the stairs. I feel a bit difficult.
Okay. Do you smoke?
Yes, I am. I smoke.
How many packs per day?
2 packs every day.
Do you drink
But I'm
alcohol?
trying to quit. Just the social with friends.
Okay. Anything? Anyone else in the family has the same problem?
No, not. None of my
what do you think the
family are
cause?
well. I don't know, doctor, but this has been troubling me a lot. You see, I'm really troubled with this. That's why I've come to you. I hope you'll give me a solution to this.
What are you hoping us to do for you?
Of course, see that this blood in my urine is actually frightening, you see? And also this pain, sometimes it is very severe and I cannot, go to work then. So if you could kindly take care of it.
What are you most concerning about?
The blood in the urine, like I told you, it frightens me sometimes.
Do you have any
have
chest pain,
cancer,
short of breath?
doctor? That's why, you know, I'm really scared.
Okay. Any chest pain, short of breath, cough, any muscle pain or joint pain?
No, I just have back pain. That's it. But I have been having this maybe because of work.
Anything else you want to add it?
No, nothing. It's just that yeah, that's it. No other.
Okay. Okay. Thank you.
Thank you, doctor.
Thank you. Can you summarize your history taking?
56 years old male, factory work, referred by GP to your surgical outdoor with complaint of painless blood in the urine, 5 weeks. With line
Yes.
to the groin pain on the left side since 2 days. Paleness and feeling of exhaustion. He is a smoker since long time and has control hypertension.
So what are your differential diagnosis?
Differential diagnosis could be urinary bladder cancer, could be cystitis, could be prostatic cancer, could be urinary bladder injury, could be urethral injury.
Okay. Could be injury. Yes. How are you planning to manage this?
The management after history and examination and the investigation, the management urine dipstick to confirm hematuria, assess infection and send the sample for
How the
cytology,
management?
blood
Yes. Yes.
and blood fall, blood count and urine and electrolyte and clotting screen and BCA and cystoscopy and biopsy and ultrasound and CT scan to detect the staging. And the treatment depends on the stage and the grade of the tumor, could be surgical and non-surgical. The surgical transurethral resection and radical cystectomy, and the non-surgical chemotherapy and radiotherapy and immunotherapy.
Very good. Excellent. Yes. You covered everything, but since like we haven't been in practice, so you took 2 minutes extra.
Okay, ma'am.
We only have to practice a lot so that we can
Yes.
cover everything within the given time. Otherwise,
Okay.
like just asked everything. Yes, Dr. Ulfat. Pain
Ma'am,
you can ask in scale from 0 to 10, 1 to 10. But then you were
Okay.
asking in other language, like if not like this, then in other. Yes,
Okay,
Dr.
ma'am.
Ulfat, you were saying something. Sorry. She was saying, right? Something. I don't know. I missed. All right. Thank you. Should we move on? Anyone want to add anything?
oh, sorry, ma'am. I didn't realize that my microphone was switched off. Sorry, ma'am.
Sorry. Yes. No.
So sorry, ma'am. Actually, he did not ask the bladder, all the symptoms of the bladder outdoor obstruction like frequency, urgency, and incontinence. He only asked me nocturia and about the stream. But I think for bladder cancer, you have to also exclude these symptoms.
I think frequency he asked. How many times do you have to go or something like this?
Dr. Ulfat, can I say something, ma'am?
Sorry?
Yeah, sure.
Actually, bladder cancer station, you will only have the painless hematuria. Okay. Most like if you say about the percentage, like in 70 to 80% patient will only have hematuria, and if there is pain, the station will be more and more longer. So in case of hematuria as a main primary symptom, so you can just ask if there is not enough time, you can just about one or two question about LUTS. And asking about LUTS, you can ask about 8 to 10 points about the voiding difficulty or something like retention type difficulty. Yeah, yes. So you preserve that for that chronic urinary tract, chronic urinary
retention. Yes.
But in this case, hematuria will be main concern. So I think, and the time is also precious as this patient is, you are also having pain. So I think it's okay for that.
Yes.
Yeah.
Sure. Okay. All right.
Yeah.
Okay, thank you.
Thank you. What is Dr. Rajab's query? He did ask family history. Fever, he asked. Okay, good. Thank you.
He asked about blood viscousis, like any bleeding from
Yes, he
any other
did. Any.
orifice. Yeah,
Hmm.
Yes,
yeah.
He did that. He did that.
Yes.
He asked all of the ones that Dr. Raju was saying.
and left loin to
How
groin
can
pain be
hematuria left
explained?
loin to groin? Because it is calculus. My most common differential
If
would be.
there is, yes, if there is an ureteric calculi, because of the pathway of the ureter, it will always be a rapid pain, like a groin to loin pain.
Yeah, yeah.
But of course, a loin to groin pain, sorry. But of course, Dr. Abhishek will know that. Yeah,
He
he
No, no,
can
it's
even
okay.
asked
say it
about the
better.
It
clots,
is.
so it was
Yeah,
covered.
Yeah,
yeah, yeah,
he asked about the clots, whether I was
So
whether the
yeah,
man was passing any clots. Yes, he covered that too.
yes.
yeah.
Okay.